Okay, welcome to the May 20th, 2024 meeting of the Yarmouth Board of Health. Just one note, this is a hybrid participation meeting, so you could be here, which I see we have a few people. People can certainly zoom in. There are plenty of instructions of how to do that on the town website. To start with, we just need attendance. Hillard Bosky. Larry, are you present? Just raise your hand and say aye.
Yep.
Charlie?
Yeah.
With that, you can do it. Thank you. Okay, Mary? I think Mary's here remotely. We see your name. Mary, are you present? I don't. She's audio's off on her part, or
She put her
Don't
microphone.
you just love it?
I'm sorry.
I said, don't you just love it?
What?
Cooperation from the people that are supposed to be on the board.
Eric, I know is not present. Is not calling in. Mary, it just. We have
Yes, can you
great.
hear me?
Very
Yes,
well.
I've logged in from the car at a parking area, so I'm going to go ahead and listen in on the way home now.
Okay, that's great. I appreciate that, and I'm also appreciative you're not driving at the same time. Okay,
Right. Okay.
let's go then. Okay, so the first item here, the agenda is a discussion on the tobacco tax warning letter. This was to Brothers Food Mart at 444 Route 28 in West Yarmouth. Apparently, on April 11, 2024, a warning letter from the director of the Mass Department of Revenue went to this business. I'm not sure that the board has seen this before, not this particular instance of having this occurred in town that was brought to the Board of Health I'm aware of.
Right. So this is not any violation, or you have no authority. It was just
Right.
by point of information, and the owner is here to give an explanation as to what exactly happened.
Right. I mean, it's relevant to us because of tobacco and,
Exactly
e-cigarettes and, oh, great. Someone come up, please. Just introduce yourself.
Yes.
Oh, have a seat. Just speak into the mic and just for
Everyone,
just
how
for the
are you?
record, introduce yourself. And
So because what happening?
sorry, I didn't catch your name, sir.
My name is Sunny Prajapati, last name, and I'm from owner in the Brothers Food Mart.
Okay, welcome.
Happening is because before the one day, as my sales rapper, he's given to 3 unit for sample pieces, and my employee he put in the for selling in the shelf, and next day revenue department guys coming in the he's given to just warning.
I'm not sure I followed all that. Jay,
So
you perhaps know.
what he explained to me earlier before the meeting was that a sample was given by the distributor, right?
Yeah,
Please
that's
correct me.
right, yeah, distributor,
And
yeah.
so it isn't marked properly as far as, it is not for sale. It was a sample. And as it turns out, even those samples, I don't believe you've moved forward as far as selling those products.
No, that's the new
But it was
new
the same-
product.
And it mistakenly got put in as on display for sale. And coincidentally, Bob Collette coming in the next day, I believe it was the next day.
Next day, yeah.
Next day,
In the
and
morning.
if the circumstances happen, he sees that, and it's a violation. It didn't have the tax code on there.
Right.
And so a display got put up inadvertently and mistakenly, and it got caught and triggered a warning by the state.
Have you decided to appeal or not?
No.
No, okay. And what's the mechanism that Revenue Department, how do they go about, identifying a problem? Jay, are you aware of it, how that happens? I'm not.
I am not. I'm assuming, well, maybe you could explain to us. Was Bob in there? It wasn't a compliance check. He was in there doing a routine check for,
He came in the every year, same thing, routine checking.
just routine checking, looking for signage, things of that nature?
Yeah.
Okay. Yeah, it's just coincidence and
Yeah.
some bad luck mixed in there as well.
Right, so have you given this some thoughts so this doesn't happen again, which would obviously be in your best interest? That was bad luck.
I'm not never taking any more in the grocery stuff in the, any product I'm not taking sample anymore.
Okay,
Yeah.
all right. So it sounds like you've given it some thought. That's great. All right, just look out for yourself.
Yeah, thank you.
Any questions from the board?
So what involvement did we have with this?
Through the chair,
Not dir-
nothing. This is
This
a
is for information, really.
point of information. It doesn't fall within the town's regulations or your board regulations for tobacco. This was simply a point of information.
Okay, good.
All right.
Sure.
Thank you.
Okay.
Yeah,
Thank you for
thank you.
coming in,
Yeah.
sir. Okay, we have a full agenda tonight. Now, we have some presentations here. These are some human service grant request applications and spreadsheets and so on that people have submitted. The town has basically been generous this year. The budget for us to distribute, I think it's $60,000. Is that correct?
But by a point of interest, by a point of historical perspective, in 2014, the board had asked for, predates me, but this has gone on since 2014, where there's funding, and this is really unique for Yarmouth, and quite frankly, a credit to Yarmouth, where, this is now outside the margins of public health, where we're doing the social determinants. Those other nonprofits and not-for-profit agencies are funded, but it strengthens and enhances the quality of life for the community. And so there's a funding opportunity here. This is now the 10th year, and we have 12 applicants that have put forward an application of varying sizes for applicants. The board will then hear from a 10-minute presentation, and then probably at a subsequent meeting, there'll be some deliberation and adjustment as to what that funding level is.
Okay, so just as courtesy to other applicants, to the health department and the board, to try to reduce your time to 10 minutes for a presentation. You don't need to use it all, and we have many more applicants than we've ever had since 2014, which is great. It gets complicated. The organizations are all great. They provide invaluable services. It's tough sometimes to compare different organizations from our standpoint of view. That's all. So we have some work to do. Let's start at the top. Right now, I think we have 12 applicants. The first is Visiting Nurses Association of Cape Cod. So please come up, sit down. The mic is yours. Just to introduce yourself for the record. Okay, thank you.
Can you hand these out first?
It's all yours. Sure.
Thanks, Meg. Thank you.
Great, thank you.
Thanks.
Thank you. Thank you, ma'am.
Hi, my name's Meg Payne. I'm the Director of Public Health and Provider Relations for the Visiting Nurse Association of Cape Cod. I have been with the VNA since 2015, and I've been giving these presentations since 2015, so thank you for having us again. Although I've only been here since 2015, our public health nursing contract is long-standing with the town of Yarmouth. I think this is our oldest contract that we have, and from my understanding dates back about 30 years. So this public health nursing contract allows us to provide much more than just nursing. It is a well-rounded public health offering to the town residents. So I'll do a quick overview of what we've been able to provide this fiscal year up to this point. So with our maternal child health nursing service, we offer prenatal care and postpartum care to moms and newborns and their families. We also have, we offer baby clinics in Hyannis at a baby center open to all of our patients. We also offer a perinatal loss support group for all of our patients. And all of our materials are translated into Spanish, Portuguese, and Haitian Creole. From July 1st, 2023 up through today, we saw 38 Yarmouth residents for prenatal visits. And we also made 72 postpartum home visits. So those are duplicated numbers. Our nurses are certified lactation counselors. They are undergoing perinatal mental health certifications next month. We do address mental health while we're in the home, both prenatally and postpartum. And what we do is try to connect these families to resources that they may need leading into the birth of their baby or babies to help set them up for positive outcomes. Our contract was able to support 7 of these home visits. So for families without insurance or who are underinsured, our contract funding was able to support 7 families. We also have a town nurse and a town physical therapist that is separate from traditional VNA home care and hospice. These are home visits we deliver to residents who don't qualify for certified home care. So an example I have of a Yarmouth resident is this person was being seen at the cancer center, had a new diagnosis, and was feeling overwhelmed. The cancer center reached out to us and stated that they had concerns. This person wasn't taking care of themselves. They weren't eating properly. They were losing weight, and they appeared very disheveled when attending appointments. So that raised a red flag. I followed up with Jay. Jay gave us the okay to go out and see this person and provide some extra teaching and education and some additional support when communicating back and forth with providers. And we were able to get this person in a better place, in a better state of mind so that they could help better manage their diagnosis. Another service that we provide for the town of Yarmouth is communicable disease surveillance and follow-up with the state. So anytime somebody goes for testing at a provider's office, urgent care, emergency department, PCP, and they test positive for a reportable disease, the specimen is sent to the state lab, and then the state will alert us of someone within our jurisdiction who has tested positive for example, babesiosis is a reportable tick-borne disease. So we get alerted to that. We follow up with the individual, gather information, and send that back off to the state, and that's how they come up with their statistics and their reports. So from July 1st, 2023 up through today, we saw just under 600 reported communicable diseases in the town of Yarmouth. And I know that number sounds staggering, but that's pretty common for what we see across the board. So we're also the town public health nurses in 14 other towns here in Barnstable County, and so that is pretty consistent with what we see across the board. Another service we provide for town residents is immunizations. We provide large vaccine clinics and also homebound vaccine clinics. July 1st, 2023 up through today. We provided 14 residents with homebound flu and COVID vaccines. And then we also provided a clinic at the Maplewood Skilled Nursing Facility where we were able to administer 28 high-dose flu vaccines, 13 regular flu vaccines, and 29 COVID vaccines. We're also the part of the Vaccine for Children program with the state. We offer free vaccine for children who have recently moved here from out of the state or out of the country and need certain vaccines in order to attend school and camp. So we have relationships with school nurses for students that need to be caught up on vaccines. We were able to serve, again, this fiscal year so far, 11 children who are residents of the town of Yarmouth to get them caught up on vaccines. We do a lot of exercise programs, educational presentations. So this year, we were able to provide two presentations at the Yarmouth Senior Center. One of them is called Know Your Numbers, and that's all about vital signs and why they're important and what, appropriate ranges are. Another presentation we just offered on May 13th is stroke awareness. So we brought in some of our colleagues from Cape Cod Hospital to help us present on stroke awareness to at the Senior Center. We also, this past Friday, participated in the Yarmouth Senior Center Health Fair, where we provided information. We did some cholesterol screenings, and it was a good time. So that's just a really high-level overview of what we've been able to provide this year. I also included, we do offer bereavement support groups twice a month at the Senior Center. We're able to offer a lot with what we have, of course, and I'm sure everyone else feels the same way. Given more funding, we would be able to provide a lot more. For example, exercise programs, we weren't really able to provide any this fiscal year just due to funding, but there is opportunity for us to be more involved with more funding. Any questions?
Any questions or comments? I just had one or two. If you determine someone has postpartum depression, I'm kind of interested on because we have a study being done over at the hospital. What happens with that diagnosis? What do you provide or recommend?
So we provide education and we help normalize, what they're experiencing with terms, common terms that of symptoms like stress and things like that. So we try to normalize it with the individual. We educate them, but we also educate their support system in the home. If they are able to identify any changes in behavior. We are connected with Cape Cod Healthcare. We work very closely with the OB offices and maternity, and we actually went live with the Epic electronic medical record system as of March 1st. So that provides a lot of transparency when communicating back and forth with providers on what's going on with an individual.
Once everyone figures it out.
Yeah, we've been doing really well. It's been a smooth transition, all things considered.
Always that at the hospitals. And the other question I have, what happens if you determine at the senior center someone is hypertensive or hypotensive? What happens then?
We would, provide education. With everything we do, we provide education, have a conversation with them. Maybe something's going on, beyond the hypertension. Encourage them, they're not our patients, so we can't really take control, but really encourage them to communicate with their provider. And, if they want our help, we can help assist in that communication.
Great. Anyone else? Anything?
I would just simply, while Meg is here, the board will remember when we had a communicable disease concern with the migrants, the migrant site here. The VNA was incredibly helpful to us navigating that. Meg was available all hours of the day and into the evening of trying to coordinate. So I just want to, while you're here, thank you on that. We were able to navigate that and calm some concerns and clarify some information on what is communicable and what the risks were to the community and things of that nature. So that was a tremendous resource. So I hadn't really talked to you since then, so thank you on that. I appreciate it.
Yeah, you're welcome.
Yeah, it was kind of a unique circumstance. We all learned a bit from that. Thanks for coming in.
Thank you.
Thank you.
Okay, next organization is Cape Cod Council of Churches Hands of Hope Outreach Center.
Good evening. My name is Catherine Driscoll,
You need to be closer to the mic, that's all, so
Okay,
people at home
Catherine
can hear you.
Driscoll.
Great.
and I just wanted to give you these.
Thank
A
you.
brochure. You
Sure.
can hopefully give them out to anyone who calls the town offices asking for any kind of financial assistance or food assistance. That's our primary goal. We've been working with the town for probably at least the 9 years that you've been doing it, or more. The Council of Churches celebrating their 63rd year this year, And there are a multitude of programs with the council, a baby center, Faith Family Kitchen, overnights of hospitality for people who need a couple of nights in a motel, homeless people. We also have support for foster families. And Hands of Hope is I would say, the charitable part of the Council of Churches programs. We help with emergency assistance, with food, and financial assistance. And most of our clients are from Dennis and Yarmouth. We have been located in Dennis for 20 years, and in 2016 we moved over the line into West Harwich. The building we were in was no longer feasible for us to rent, and we wanted to stay on 28 because at least 30% of our clients take the bus. Obviously, we're a 501c3 charitable organization. We get support from the council members, of which there are 40 plus churches and synagogues and other houses of worship that are part of the Council of Churches, and we get support from grants, individuals, and we have different municipal contributions. The towns of Dennis, Yarmouth, and the federal government, we get money from FEMA through emergency food and shelter. So our mission is to provide emergency assistance with food. We do have a food pantry open 5 days a week. We also have a delivery system that we work in concert with the county food coordinator, and she sets up the delivery program and we provide the food. We use capabilities, community connections, and volunteers to deliver the food. We deliver to about 60 Yarmouth residents a month. We also help with emergency assistance for eviction, prevention of eviction, utilities, and heating oil. And one of the things we want to do with the Board of Health funds, the human service funds from the town of Dennis are just a tad bit different. But because we're working with the Board of Health in Yarmouth, we like to use those funds for problems that come up throughout the year with people who have an issue with trash. We've done many dumpsters. We've done basement cleanouts. We've done Chase and Merchant and Nauset disposal runs. We've done water bills, people living with no water, people who have no power, living for months on end with no electricity, people who have no heat and are putting kerosene in, which is just a real safety issue. So we try to use the funds that we get from the Board of Health to cover most of that. We also have another contract with the town of Yarmouth through community preservation, and that is for primarily, well, I should say totally, for eviction prevention. And one of the other things that we do is to make sure that every unit we support in any way for rental assistance is registered with the town and inspected. We'll contact Jay and Christine and just to make sure that every unit we work with is registered with the town. So they have an idea as well of what's out there, who the landlords are, and what some of these places look like. We also help with providing SNAP applications, fuel assistance applications, and we do any number of other resources. People call us all the times for things as minor as, and we would work with the visiting nurses actually on this, the town nurse. We have people call us looking for medication for lice. They can't bring their children back to school, and they can't afford something as like that. So we have many personal requests as well. Last year we helped 539 people in the food pantry, including the deliveries. We helped 89 people for, 89 households. I'm going to say 539 households, not individuals, for food. We had 89 households received help with just this portion of the funding we receive here. There's different numbers for community preservation. This 89 households were for eviction prevention, rent, not the rent that we see through the CPA, where people are 2 and 3 months behind thousands of dollars. This might just be where they paid what they could and they're a little behind, and we can make, because it's so hard, we all know, to find a new unit now. So if we can help keep somebody in a unit, and it also keeps some continuity in the schools for sure, to have people moving in and out of the town. And that 89 households also include utility shutoffs, reconnects, delivery of heating oil, water bills, trash disposal. We've even bought a couple of, in the past year, we've bought some Yarmouth stickers, not for the beach, but for the dump. So in total for the previous fiscal year, we helped 628 Yarmouth households with those assistances. The town of Yarmouth makes up 38% of all the people that we help. And we also provide backpack assistance at the end of the summer and going into at the beginning of the school year. We work with some of the schools to see what it is we could help with through the nurses, and we also have families that come into the pantry that request that. Most of our funding, I believe I said, was from 20 to 40, depending on how many are currently in the council. Churches that help us, we get funding from the Needy Fund. They work with us on many. We also work with the St. Vincent de Paul on many ways that we have to get together to help one particular household. And we get annual pledges from our individuals that help us. We get help from different golf clubs and Dennis and Yarmouth Men's Club, the Board of Realtors, and the members of Multiple Listing. So that's what we do.
It's a good summary.
You're welcome.
Board member,
Questions on the dumpsters and cleanouts is, do you just supply the dumpsters and have the residents do the cleanouts, or do you have a team that help?
Well, we've done both. We have paid for the dumpster to be dropped off, or we pay when it's full. And we've also had a Boy Scout troop go and help. But we've been cautioned that that could be some liabilities, so we've mostly just left it up to the individuals. But because there's always a time limit, and sometimes people just are not able, for whatever reason, they're either older or they're have other handicaps, that we will, if we have to, try to find some help.
Okay. Is there a limit, like on how much or how, like if it's excessive?
Well, the last dumpster situation we had, it was $1,800, so it was 2,900 fill-ups. And, at that point, I would call Jay and ask for an inspection. I mean, some of the time when you go, you can see that they have been able to go to the dump, and it's a buildup of trash bags.
Yep. Okay.
And so that might not even fill one dumpster. So it depends on if it were extreme, we would not do anything ourselves until we got some guidance.
All right. Thank you very much for that.
Anyone else? Mary, just speak up if you have something, okay?
Just tired listening to all they do. It sounds great.
Yeah. Okay, thank you for coming in.
Thank you.
That's very helpful.
Thank you.
Welcome.
Okay, Big Brothers Big Sisters of Cape Cod is next up.
Actually, is it
Independent House.
Independent House?
Is ahead of it? Okay,
And
fine.
they're- and
Doesn't make any difference, really.
They're
Indep-
virtual. Independence
Someone
houses?
is calling in?
Yes.
Is someone calling in from Independence House? Good.
Bob?
Yeah, he's listening. Okay, great. Welcome. No, do we lose? There we go. Okay, we can see you now. Right now we can't hear you yet.
Okay, how's that?
And that's complete, yes. You're fully present. So just introduce yourself. Thank you for coming in.
Yes. Good evening, everyone. My name is Lisetta Hurge Putnam, and I'm the executive director of Independence House, which is an organization that provides resources, support, advocacy to victims / we could say survivors of domestic and sexual violence. What I want you to know about Independence House is that we've been on the Cape for a long time, since 1979, founded on Cape Cod by Cape Codders. And our mission back then was to provide a safe place for, at the time, women who were victims of domestic violence. Because there was no safe place for them, those that couldn't be at home. And that mission has remained pretty relevant even after over 40 years. And we expanded our mission to work with survivors of sexual assault as well. So what I can tell you as someone that's been around for a long time, I've been the executive director for 25 years, and I want to take this opportunity to really express my thanks to the town of Yarmouth, Department of Health, for all of the support that you've provided in terms of funding to help us to serve survivors of domestic and sexual violence. So our organization really, all of our programs are designed to address the, I would say, myriad of issues that come up for someone that's experienced domestic violence or sexual violence. Some of those programs include like our Safe Plan Court Advocacy Program, that's where we have staff that are actually situated in the courthouse. We have little offices there. And that's what many people may typically think of as a restraining order. So that's just one continuum of the services that we provide. We have a hotline that's open 24/7. We serve people from ages 5, up to 80, I'd say, across the lifespan. So we work with children who have been exposed to domestic violence at home. And the reason for that is because it does have a traumatic impact on many children who may have trouble in the classroom concentrating. And we also work with children from about the ages of 5 to 12, where there might be a report of sexual abuse as well. We mainly work with adults in the age range of about, say, 30 and up, although we do work with teens as well. One of the programs that that we've been excited about for a number of years is what we call our Mentors in Violence Prevention program, and that is in the Yarmouth school system, in the high school, where we teach students strategies, I should say, to be active bystanders in violence prevention. And we're hoping to move forward with that next fiscal year as well. We're also particularly concerned about what we call adults in later life who are also impacted by domestic violence. They have different needs, so we want to make sure that we're able to address those needs. For some people who are younger, they may decide to go into, say, we have a shelter program, we have a housing program. For older adults, really, we have to assess with them what's right for them. Most older adults are not going to leave their homes to go into shelter, go into housing, but they might call our hotline for support, or we may work with them at the senior center. Just depends on the particular individual. So last year for the town of Yarmouth, we served over 1,000 clients. These are duplicated numbers. Cape-wide, we serve about 8,000, and annually, that varies. It could be anywhere from 6 to 10. It just depends on the year. And our request to the town of Yarmouth is for $12,000. $9,500 of that is for what we would call, quote unquote, general domestic or sexual violence services. And the remainder we would like to dedicate to our MVP program and our adult in later life program. So I guess I would provide clarity by saying we're a comprehensive organization that my term that some of you have heard me say before, it's from soup to nuts. It doesn't mean that we're trying to fix everything for all the survivors we work with, but what we do want to do is to be able to provide a comprehensive array of responses for survivors. So I did put my timer on, so I'm going to stop there and ask for questions, if there are any.
Anyone? Yes.
Barry Lewis, Assistant Director. Question for you. Do you work just with female survivors, or do you work with male survivors also?
We actually work with male and female survivors. I also did forget to say, I should give a shout out. We do collaborate with the Yarmouth Police Department as well. And Annie, who is the domestic violence advocate, there's a former employee of Independence House, and we still work closely together. But I will say, to answer the question even more specifically, this is why we do not identify, we don't say we work with women. A lot of women are impacted by domestic violence, but we have, obviously for you would know that we have, male survivors of sexual assault, but also people who might be in same-sex relationships or men. So we work with victims or survivors. We don't like the word victims, so we use it interchangeably with survivors.
All right. Thank you very much.
You're welcome.
Anyone else? Charlie? Larry? Okay. Thank you again. That was
Thank
very
you.
helpful for the board. Okay.
Thank you for the opportunity.
Okay, be well.
Bye-bye.
Okay, we're up to Big Brothers, Big Sisters of Cape Cod, if someone's here tonight.
Virtual as well.
You can see it, yes?
J.R. Mel. He's
He's in.
Okay, there's the name, all right. There we go. Okay, we can see you. And we just need audio, I think. Just need to hear you.
Can you hear me?
Yes, perfect.
All right.
Welcome.
Thank you, everybody. Apologies, I had planned to be in person, and the best laid plans sometimes just don't happen. So thank you to the town of Yarmouth for giving us a few minutes to talk about Big Brothers Big Sisters and the work we do on the Cape and Islands, but in particular for the youth of Yarmouth. Big Brothers Big Sisters, I like to say, does one thing and we do one thing well. We're a one-to-one youth mentoring program that provides youth from the community between the ages of 7 and generally around 18 with a thoroughly screened, caring adult mentor to meet with them in several different program models. Specific to Yarmouth, we run 3 different program models in which we serve youth. Our first is what everybody thinks of when they think of Big Brothers Big Sisters, are what we call our community-based mentoring program. It's a big brother, big sister, little sister, spending a few hours 2 to 3 times a month out in the community doing activities that they would enjoy doing anyways. Our program really focuses on the core of social and emotional learning for kids. And no matter what our program model, each kid is evidence-based to show gains in what we measure for social and emotional learning, calling the 6 C's. Our second program that we run in Yarmouth is in partnership with M.E. Small Elementary School. It's called the Lunch Buddies program. This program partners with various employers in the region, for example, Cape Cod 5, Cape Air, Shepley Wood Products, just to name a few. And the employers allow their employees an additional half hour on their lunch break to be a mentor to a kid in the school. This program model helps us to serve some of the highest need kids whose family potentially couldn't partner with a big or has just too much going on to meet the requirements of the community-based program. And so in this partnership with M.E. Small Elementary, it allows, once the parents given permission, it allows the school to take a coordination with us as well as the big brother or big sister for those meetings that take place at the school. Those meetings are once a week during the school year over the lunch and recess block, same focus on social and emotional learning. Our last program model we run in Yarmouth is part of our Canine Sergeant Sean M. Gannon Bigs with Badges program. Sean Gannon was a 3.5-year big brother at the time of his death, and we've renamed our program in honor of him. Through Sean's program, we recruit officers from various police departments, including Yarmouth, to spend time 2 to 3 times a month or in the Lunch Buddies program once a week, being a mentor to a child who could benefit from that additional adult guidance. I've been with the agency as the director for the past 8.5 years. We've been fortunate enough that the town of Yarmouth has been a strong supporter of our programming. In my 8.5 years here, we've matched 78 kids from the town of Yarmouth with a big brother or big sister. And currently we're serving 36 kids in the town of Yarmouth in what we call an active match. So they're still active participants of our program. They haven't graduated out and are still seeing each other on a weekly or bi-monthly basis. Gonna pause there. Any questions?
Anyone? It was very succinct. Yeah, sounds like great work. Thank you.
Well, thank you. The Board of Health has been a strong partner with us for my 8.5 years, and from the record that I've seen for much longer than that. So I appreciate all that you do, and I would have to fire myself if I didn't encourage anybody listening who might want to be a big brother or big sister to check out our website. It's our biggest need right now. So thank you.
Glad we could provide that just now. Good. Okay. Thank you.
Mr. Chairman, if I could, I just want to introduce the newest member of the Board of Health has joined us, Monique Daly, and she's taking over what was Erica Polite's position. But the Board of Health, and you'll get a chance to meet them in person, but just want the Board of Health to recognize that this is the newest member of our staff at the Board of Health.
Welcome.
Welcome.
On week, 3? Start week 3. Yes. Week 3. So, Mo, thanks for being here.
Contact me anytime you got some questions or anything, okay?
Okay, thank you.
Okay. Okay, we're up to the Family Table Collaborative.
Thank you. My name's Harry Henry. I'm with Family Table Collaborative, a local nonprofit here in Yarmouth. We are all of 4 years old about this month. We started during COVID, and our mission is to provide healthy, prepared meals for people who need them. So we this is the first time before this board and for this application, and I filled it out at the suggestion of the Senior Center, Yarmouth Senior Center. So in the course of the past 12 months, we've provided about 35,000 meals across the Cape. These are prepared meals. Think of them just like takeout you would from a restaurant, and people take our meals are already cooked and prepared, bring them home, heat them up, and they're good to go. Specifically in the town of Yarmouth, we've in the past 12 months we provided 1,815 meals in the town of Yarmouth to both the Yarmouth Senior Center and in the Yarmouth Housing Authority offices. So we reach out to them every week to find out who needs meals and how many they need, and we prepare them and then deliver them. We do some open distribution where we have people text us and we give them a time and date and location to pick them up. And that's across the Cape in various towns. But specifically for Yarmouth, it's 1,815 meals. And so my calculation was based on looking for a little bit of support out of this Human Services Fund to offset about $3 a meal. So that's the $5,445 I've asked for here. It costs us about $7 cost out of pocket to get a meal out. So we're looking for a partial help in terms of what we do. We operate out of the old Riverway Lobster House. We are a volunteer-led organization. We've got about 500 volunteers. We take in donations of food, but that doesn't cover everything it takes to put a meal out into people's hands. We do a good job of getting donations on produce and veggies and starch. Nobody ever donates protein. So that's where the dollars go in terms of buying food we need to produce the meals. Any given week, we're producing between 700 and 1,000 dinners. And the donations we get don't cover producing that many meals, so we're buying a lot of food. We're also buying packaging. That's another part of the cost of producing the meals. You got to put them in a package in order for people to take them home and heat them up. And you got to operate the operation. The utility company doesn't really care that we're a nonprofit feeding people. They send us a bill, and so with the number of burners and stoves we have and walk-in coolers, there's a big utility bill. So those are the kinds of costs we have. We are not. Our funding comes mostly from individual donations, from a few grants. We don't get any federal money. We do operate different food services out of the Riverway. We do catering, we do events, and those are revenue generating to help us pay for the mission of the collaborative. So that's who we are. Like I said, it's volunteer based. It's throughout the Cape. We provide meals from Falmouth, Sandwich, all the way up to right now up to Eastham and Wellfleet, and serve basically every town on the Cape. Our meals go into not only a senior center just like here or housing authority, we do a couple of other housing authorities, but group homes, veteran homes, some shelters. So those are the people that tend to need the dinners that we provide.
Do you provide any meals directly to people's homes where they're not able to travel?
No, we do not deliver to homes.
Okay.
We deliver in a couple of reasons. Number one, it takes a bigger army than we have. But also, what we found over time is that often the people who may need a meal or in need of a meal also need other services. We're not a social service agency. We provide meals. And so it's better that we put the meals in the hands of the folks that are closest to the people, into the shelter or the group home or the senior center or whatever. And they know the clients better than we ever will. And so it's better that they do that.
Are there any opportunities where you can get food from off Cape or from Boston that can be sent to you?
Well, we do purchase from off Cape. The big food distributors
Yeah.
we purchase from, yes.
And all that has to be paid for.
Oh, yeah.
Yeah.
The donations we get, typically, the biggest donations we get of food are from Whole Foods Market, Stop and Shop here in Yarmouth, and the Capabilities Farm, Barnstable Organic Farm, and Chatham Bars Inn Farm. We take in about 2 tons of food a week.
Wow.
And yeah, so it takes that kind of an army. You got to sort through it. You got to figure out what you can use. You got to figure out what you have turned right back. We have partnerships with missions and churches and all, so they can take care of the families. If we have stuff, we have to turn around quick. And just for example, I walked in the kitchen 2 weeks ago, and there were 14 cases of bananas there. Now, we don't make that much banana bread. I don't know what else you do with bananas. I don't know who out there bought 14 cases more than they could sell, but we wound up with that kind of a product. And so we're able to call a couple of churches and ministries and say, hey, we got bananas, can you get them out to your folks? And we can distribute them out that way. But, the typical thing is rice, potatoes, pasta that we can put into a meal. We'll buy the chicken, we'll buy the pork, whatever. And then, of course, especially in the summer, we get all the produce from the farms. We'll get cases and cases of produce. But the big challenge for us and for anybody that would take in food like this is you have to first go through it. That little spot on an apple can't be sold in a store, but we can cut it out, we can chop it up, we can use it for something. Then you gotta cool it, right? So we got double walk-in refrigerator, we got a walk-in freezer. So we have people that go ahead and process that food, put it into the coolers, and then the chefs can figure out how we're going to use it into dinners later. So it's a big, many piece part moving operation. And like I said, just specifically for the town of Yarmouth, we go to the senior center every week with meals, and we go to the housing authority, I think, twice a month with meals. And like I said, to the total of over 1,800 meals in the past 12 months.
If people from the community want to donate food, what's the best way for them to do that?
On our website, there's a place to donate food, there's a place to donate money, surprisingly. There's a place to volunteer. Different tabs hit it. And
the website is? People are listening.
www.familytablecollaborative.org.
Okay, any questions, anyone? Thank
Yes,
you.
I know you said you're not a social services agency, but I think I've read about sessions that you've had there at the old Riverside House restaurant where you had agencies come in from the community and gave out information on the resources that they can provide.
Yes. Yeah, we partner with a number of different agencies, and they'll hold different nights. Sometimes they're holding a coffee or like an appetizer event or just an information session. But I think most people know, the size of this place is pretty big. It's one of the bigger facilities around, so you can fit a couple hundred people in there. It's a good way for the community to come together. And if I could, just one side note, we rent that facility. That is owned by the person that still ran the Riverway. And one of the things he told us when he decided to close the restaurant was he could sell that building and others would come in, and somebody would come in and probably run a restaurant. But he thought the building itself had a bigger community purpose. And rather than sell it, he wanted to see it go to some community purpose. And so luckily we found each other and were able to do that there. So just to what you just said, ma'am, we have a great space that the community can use, and we do use it for a lot of different service organizations in the community.
Great, okay.
Thank you.
Yep.
Thank you. Thanks for coming in.
Thank you.
Okay, we're up to Behavioral Health Innovators. Anyone here from the organization? Anyone calling in?
she is. Stephanie?
Okay. It's Stephanie?
Yes, can you hear me?
Very well. Welcome.
Thank you. This is my debut appearance before the Yarmouth Human Services Committee, so I really appreciate it, and I guess it's the Department of Health we're addressing right now.
Excuse me, I hate to interrupt. Just introduce yourself, your name, so people at home can know who you are by your name. That's all.
Sure. I'm Stephanie Bryady. I am the CEO of Behavioral Health Innovators. It's a nonprofit that's been on the Cape since 2015. And we work to address the gaps in services for the 13 to 24-year-old population, especially as regards substance use challenges and related mental health issues. So it's a pleasure to see you or meet all of you. And I want to tell you a little bit about Behavioral Health Innovators and then address the specific program that we are seeking funding for. So the organization is working to create a continuum of supports for young people, particularly that age group, the 13 to 24 population, but primarily the students in our schools, and in this case, Dennis Yarmouth Regional High School. Our very first grant was a $500 grant from it was a philanthropy class, an 11th grade elective at DY High School, which students were very concerned about their friends and the substance use problems that were plaguing their friend group and their schools. And out of 100 organizations, they selected ours because they said that we were working to create safe, supportive spaces where teenagers could gather, build awareness around their substance use, and find the tools to address, a more positive plan or pathway to wellness through those tools. So I don't know if you've heard of Recovery High Schools, but we have 5 in Massachusetts, and that is a model of a school where students who are substance dependent can get their academics done at the same time getting recovery supports. And Cape Cod does not have a recovery high school, but more importantly, the gap in services for teenagers either with a substance use issue or coming back from treatment from a substance treatment center, there's no supports on Cape once they come back onto the Cape. So we partnered with Dennis Yarmouth Regional High School back in 2017 and started an alternative peer group, which is a program you may have heard of and is supported, by the towns Cape-wide. And that's a program, a 6-month program. We partner with Duffy Health Center in that program. There's a site in Dennis and in Falmouth, and students come after school 2 days a week for counseling, recovery coach support, peer mentor support. And it's remarkable how many young people can find recovery in their teen years. So these are young people that are on a path really heading for a full-blown addiction and can really, address that in a safe and supportive space that we've created. The program that I want to talk about today is another program called the PASS program. So as you can imagine, students facing suspension and sent home from school for substance use or other behavioral problems don't usually get better as a result of the suspension and the time alone at home. So this is a program that actually was launched on the North Shore back in 2017 that we learned about at a conference. And it's a brief intervention and referral to services for teenagers, students facing suspension. And it is now open to students not only facing suspension, but students who need substance use support and mental health support. And the program last year served 100, and this current year, 2020, 3 to 24, served 120 students, and the prior year it served 92 students. So over 200 students have gone through the PASS program. It stands for Positive Alternative to School Suspension. And we are poised to open a middle school PASS program. DY High School and DY Middle School, Intermediate School, are partners in this endeavor. And we're the ones that came to us and asked us to create something that would supplement the social emotional tools and programs they had inside of school, but to particularly address the harmful effects that suspension has on this young population. So just briefly, the metrics from those 200 students, 70% when they come into the PASS program, they are assessed by a licensed clinician. 70% have a severe mental health or substance use diagnosis. Of that 70%, only 30% are getting services. So the program, it's usually a 5-day stay at the PASS program. It's held in Centerville, which is, located, in kind of in the middle of the Cape, so most schools can get the transportation that we provide to program. So it's a referral, a brief intervention and referral to services. On the Cape, there's at least a 3 to 6 month wait for a young person to get in to see an individual counselor outside of school. And one of the things that we've learned in the practice of the program is that students are much more likely to self-identify concerns outside of school than inside of school. So, for example, one of the adjustment counselors at DY said, we've known since this student was in 7th and 8th grade that they had likely had a substance issue, but they would never open up and identify it. And when they came to the PASS program, speaking to the counselor there and being with other peers from other schools, they were very open and ready to share what their struggles were and to get some support. So there's a reentry meeting back into school when they complete the 5 days that PASS, and they have strategies and plans, and more importantly, they're referred to services. So some of them with the substance use issue can go to the alternative peer group program that I mentioned. Others are plugged into services, individual counseling services, and families are supported because many of the issues are, family issues that we have uncovered. And when we get the family the support they need, then there is, you see the wellness, show up in the young person. So most of the students who fill out the survey after PASS, and we do a survey with the school 30 days out and 3 months out to see how they're doing, most of them will say they want to go back to PASS. They wish school was like the PASS program. They do get their homework and schoolwork done in real time. There's a tutor there. And it's really kind of Cape Cod's version of a recovery high school, if you will. And I'll take some questions if there are any.
That was great presentation. Thank you. Anyone? Questions? Anyone at home? Mary? We're in the car.
No question.
You good? Okay. Thank you.
I will, with just a little bit of time left, may I just add?
Absolutely.
We've served 20 students from 20 Yarmouth resident students from DY. So from the town of Yarmouth in the last year and a half that we've been open. And we've also kind of shown that the cost of the program is over $2,300 per student. So, it's not an inexpensive endeavor, but if we are ever going to get ahead of the addiction crisis on the Cape, we need to start with our middle schoolers and our high schoolers. Thank you.
I'm sorry, I just have one question. What is, of your volunteers, looks like there are 25 of them, what do the majority of them do in the organization, volunteer?
That would be fundraising events in order to raise funds for the programs. We get a lot of funds from towns, human service departments in the towns. But also, for example, we have a pickleball tournament coming up on June 1st, if anybody's interested. So they run a lot of the fundraisers and support the program by, getting out into the community and talking about it. As you can imagine, not a lot of people are very forthcoming about their child's substance use or their own substance use on Cape Cod.
For sure. Okay, thank you.
Thank you.
Okay, we're up to Harbor Health Services. If someone's here this evening.
Amy's online.
Anybody up there?
Yep. Harbor Health. Looks like Amy is.
Okay. There was Amy, and now I don't.
Hi. Can you hear me?
Very well.
Yes.
Very
Oh, okay, great. It doesn't look like my camera is working at the moment, so apologies. Not sure what's going on. Are you able to see me, or is it just hearing?
We just hear you. We don't
All right.
see you.
All right. Well, apologies that you can't see me. I'm not sure why. But first of all, I just want to introduce myself. I'm Amy Bowen. I am the Vice President of Marketing and Community Engagement at Harbor Health. Some of the areas that I oversee include our grant funding and community relations, which is why I have the honor of being here tonight. Again, my apologies. Not only can you not see me, but I'm not in person. I was scheduled to work out of our Mattapan office today, so not able to join in person. Tonight, I wanted to talk a little bit about our dental assistance training program. This is a healthcare workforce on-the-job training program that we're very proud of at Harbor. Just by way of a little background about Harbor, we are a registered 501c3 organization and also a federally qualified health center. That means we serve everyone regardless of their ability to pay or their insurance status. And one of our primary focuses is really providing access to healthcare and social support services for underserved populations. We have 2 locations on Cape Cod, Harbor Community Health Center in Hyannis and our Ellen Jones Community Dental Center in South Dennis. Between the 2 locations, we provided care for about 2,400 individuals from Yarmouth in 2023. Very interestingly, and particularly important for this program, we're one of a very limited number of dental care providers that take Mass Health, which is Medicaid, for adults and children on Cape Cod. Our proposal is for $10,000 to support a dental assistance trainee at one of our Cape Cod dental locations for a training cycle which lasts about 4 months. Just as a little bit of background about our dental assistance training program, right now you may have heard this, that there is a nationwide shortage of dental assistants. It's particularly challenging for Harbor on Cape Cod to find qualified dental assistants. We are competing against private practices, and we just are not able to compete with the salaries for this really in-demand position where there are just not that many people who are qualified dental assistants. And one of the big reasons that there are not a lot of qualified dental assistants is because the cost of the classes and licensure really create a lot of barriers for prospective dental assistants. Oftentimes people are looking at trading off a paid job to go to school to get classes and then pay for a licensure, which is just not very accessible for a lot of people who otherwise would be terrific and are very interested in pursuing a career in dentistry. Some background about Harbor. When we first opened Ellen Jones Community Dental Center in 2000, we were originally located at Cape Cod Technical High School. There was literally a classroom inside the practice where students who were in the high school's dental assisting program would go to class, and then they would come outside of the classroom and do on-the-job training, like literally put the things that they were learning just that morning to use and in practice at the dental clinic. And we were there for many years until the high school moved locations. And then when Ellen Jones moved to its new location in South Dennis, we decided to really build on that knowledge that we had about on-the-job training for dental assistants and create a program that was open to the community that would really create that access for people who would be interested in becoming a dental assistant, because again, it is an in-demand profession. There's a nationwide shortage, so there is a lot of demand for this particular position. This way, we were really addressing a very chronic workforce challenge for us head on. It promotes an opportunity for year-round employment within our community, and it really would aid us in providing access to dental care services for our underserved patients. Just the reality is, no matter how good a dentist is, sometimes there are just procedures where you need 4 hands. You can't just do it with 2. And when we don't have enough dental assistants to help dentists with their procedures, they just are not able to see as many patients. So this program, the Dental Assistance Training Program, really helps address all of those things: the access to care, the access to year-round employment, and access to a new source of staffing for us. And one of the interesting things is if you compare Harbor Health's the cost of our program, we cover all the additional courses that are required, like the basic life support training, a radiology course. We cover the fees for those classes while somebody is receiving on-the-job training. Usually when someone's hired, within a week, they're contributing to clinical needs, and they are paid while they are doing their on-the-job training. And typically, we aim to have somebody complete the dental assistance training program within about 4 months. And at the end of that 4 months, they're taking the dental assistance license. You could compare that, say, with BU School of Dentistry, where it costs several $1,000s. In order to take a dental assistance training program and complete the licensure. You're not paid while you're doing it. You're not employed. And same for some of the online programs that you could take. There's still a lot of costs associated with that. Since we started piloting the program, first at Ellen Jones, and then we expanded to Hyannis, and then have slowly expanded at our other locations off the Cape, in Plymouth, and in Boston. On the Cape, for example, we've had 13 dental assistants participate. Typically, we try and run it twice a year, around the fall and late spring and summer. So we currently have a session running right now. We try to train between 1 and 2 dental assistants at a time. That's just a way with staffing and making sure they have enough support while they are receiving training. And on the Cape, so far, since we have reintroduced the program in 2021, we've had about 13 participants participate in the training program, and we have about a 92% completion rate. People opt out of the program for a variety of reasons. Oftentimes it's personal circumstances that they're not able to complete the program. We've received really positive feedback, not only from the dental assistance trainees who just never thought they would have the opportunity to enter the healthcare workforce without to get this kind of on-the-job training without having to make some sacrifices financially on their end. So this was really a profound opportunity for them. And it's really, inspired our staff too, who gets to be part of training people for this new career and have them be part of the team almost from day one. So it's been really beneficial, both from this growing the healthcare workforce standpoint and also for our staff just feeling motivated and inspired and really feeling like they're giving back to the community beyond just providing dental care and services, which is important, but just goes a little bit further. So I'm happy to take questions. We really, really appreciate all the support the Board of Health has given us in the past with funding for both of our health centers on the Cape, and hope you'll consider this proposal as well.
Questions, anyone?
Yes, how many of the 13 that you have trained and graduated have been retained as staff members for you?
I'd have to double check. My colleague, Erin Malini, who is the practice manager at Ellen Jones, wasn't available to come tonight due to something previously scheduled. So I would have to check with her. My understanding is that the retention piece has been challenging for us. we are able to keep keep the trainee at least for a few months after they are trained. And then we often find that we are losing them to private practice where they earn more money. So we can't really blame them for that. We feel fortunate they were able to help them on their career. But that kind of speaks to why having this continuous training an option for people to bring them into this workforce, to give them the training and try and inspire them to be a part of a community health center is so important to us. We fund this program through a variety of grants. This is something that we try to keep going, and we try to offer to a variety of people, often who don't really have any experience, and sometimes in some cases no degrees. So this really is a true entry level on the job kind of pathway forward for a lot of people. So we certainly understand if they are opting to go to a practice that just offers more money, but it does overall help with the workforce in the community. This is the shortage of dental assistants impacts all dental care everywhere. It's not just at Harbor or public health or federally qualified health centers. It's everywhere. So still giving back to access for dental care. Thank you.
All right, that was very clear. Thank you. Anyone?
Sure.
Yeah, Barry Lewis, Assistant Health Director. What is one of your biggest obstacles in getting or recruiting new students?
In recruiting new students, I think helping them, we definitely have had a good response whenever we've done recruiting for this particular opportunity. We usually don't have a shortage of people applying for the dental assistance training program. It's the qualified dental assistants that we have the shortage of. People are just so excited to see that they can get paid to get on-the-job training, to get a lot of their fees and classes and even their licensing exam fee paid for, and they get all sorts of support to take the exam. So it's not the dental assistant trainees that we have many challenges recruiting. It's really, we have to keep the program small. That's due to our staffing and just making sure that people are getting the attention that patients and the dental assistant trainees are getting the attention they need to really learn and get that on the job training. So it's intentionally small, but it still remains that the recruiting issues for dental assistants, once they've gone through the training program, is really challenging. And again, that just goes back to, for Harbor anyway, we're a public health agency. We serve underserved populations. We just can't offer the same level of salary as a private practice. So that's our biggest challenge for dental assistants.
Right, so. Thank you.
Mm-hmm.
Okay, thank you.
Thank you.
Okay, next up here is Dan Gates, looks like AIDS Support Group of Cape Cod. Thanks.
Thanks a lot. Thank you so much.
Hey, good evening, everyone. My name is Heather Murphy, and I'm the Chief Programs Officer for AIDS Support Group of Cape Cod. Thank you so much for allowing us to present to you this evening. Thought I would go ahead and start with our mission. The AIDS Support Group of Cape Cod saves lives through prevention, education, and life-sustaining services that address public health crises to build healthy communities across the Cape and Islands. ASGCC is now the only AIDS service organization on the Cape and Islands providing services to ensure that our clients have access to a continuum of care that meets their needs. We provide 3 types of services: direct services to people living with HIV, prevention and screening services for HIV and other STIs, and harm reduction services to address the substance use crisis on the Cape and Islands. Services are available at our brick and mortar sites in Provincetown, Hyannis, and Martha's Vineyard, and through our 2 mobile outreach vans. One is a large van that houses 2 confidential offices and offers all of our services, and is based primarily in Falmouth. And the second is a smaller van which offers mostly harm reduction services, that's based in Hyannis, and serves all of the Mid and Upper Cape. Our services are always free and available to all, including residents of the town of Yarmouth. Examples of some of the services that we provide include medical case management for individuals living with HIV. Those services include ensuring continuous access to comprehensive medical and prescription health coverage, helping to maintain engagement and retention in medical care and HIV prescriptions, assisting in applying for appropriate financial benefits, providing access to food resources and referrals, including SNAP benefits, local food pantries, and our monthly ASGCC food boxes. Assisting with transportation services to medical, dental, and behavioral health appointments, and providing housing assistance, including help with housing searches, advocacy with landlords, referrals to temporary housing, support to complete housing applications, and assistance with renewals. For our harm reduction services, we have syringe exchange program. We offer fentanyl test strips for individuals that may want to test their substance to determine if fentanyl is in the substance. Sexual health screenings. Short-term health navigation, which is meeting with individuals and helping to determine if they need additional resources and services and connecting them with those services. We provide Narcan trainings and Narcan distribution and education to individuals as well. I've included in your packet information about the data for those services. We pulled a comparative analysis for FY23 and FY24 up to date. So for example, in the town of Yarmouth, we collected in FY23 7,350 syringes, and to date, we've collected 6,570 syringes. Fentanyl test strip distribution has increased significantly, as we know that fentanyl is sort of an emerging issue, and we want to make sure that people have the information that they need about fentanyl. So that has increased to 143 fentanyl test strips. And for our case management services in FY24, so far we have provided case management to 21 individuals in Yarmouth, and housing, search, and advocacy services to 3 individuals so far. I also included some information about overdose deaths in Yarmouth and then in Barnstable County. We know that opioid-related overdose is a significant concern, and that's directly related to a lot of our services, including Narcan education and training. Does anyone have any questions?
You're listing Narcan encounters. What qualifies something to be an encounter?
So meeting directly with the individual to provide them education and distribution.
Thank you.
You're welcome. Any other questions, everyone?
Anyone?
Good, thank you.
Thank you for your time.
I appreciate you coming in.
Thank you.
Okay, capabilities is,
So, Mr. Chairman, unfortunately, due to a scheduling conflict, you have their application, but they weren't able to be here tonight to present. They apologize, but just because of the scheduling conflict of their own, they couldn't be here.
okay. So we certainly can discuss that when we talk about the whole thing. Okay.
You have their package.
So, it's Sight Loss Services here on the list.
Okay. Not really a goodie, it's just a brochure.
Thank you.
Okay, thanks.
That's great. Thank you.
So my name is Rhonda Guerin, and I am the Executive Director of Sight Loss Services. We are a nonprofit organization that supports folks on Cape Cod who are blind and visually impaired. We are located in South Dennis, but we do serve the entire Cape, and we are also starting to branch out a little bit into the islands. So, unfortunately, the chairman of our board couldn't be here tonight. He's sort of our funding guy. He secures the funding, I spend the funding. So I will talk to you about a little bit about what I spend the funding on. And since he wrote the grant, we've also expanded a little bit of our programming. So I think he mentioned 7 areas, and we now have 8. The first one is our information and referral network, and that's just the way it sounds. Somebody calls the office with a question, and we hook them up with whatever service they might need based on their question. The second one is education and awareness. This includes our quarterly newsletter, and it also includes things such as health fairs. And I had the pleasure of attending the Yarmouth Health Fair, or the Wellness Fair, the Good Health and Wellness Fair on Friday. And I spoke to several folks, lots of folks actually, and we have a few new members of our support group that are going to be attending the next meeting, which is tomorrow. The next area that I wanted to talk a little bit about is the office visits and adaptive aids. People can come into the office in South Dennis. They spend about an hour with us, and we go over all sorts of things. We start with things like lights. Lights are the first thing we talk about, and anybody who comes into the office for an office visit leaves with some sort of a light, either a mini light like this, or we have some larger ones. They also go home with some sort of a tint that is appropriate for their eye condition. In the case of macular degeneration patients, it's yellow usually. And then we have tints that are appropriate for glaucoma patients, for diabetic retinopathy. There are just a bunch of different tints, and what I like to tell people is it's like your hair. You come on in and I'll help you find your color, and then we'll get you a set of frames that suit you. And then everybody leaves with a magnifying glass, a lighted handheld magnifying glass. They are a little higher end than what you get at CVS or Ocean State Job Lot. And we're really proud and really happy to send everybody who comes into our office home with one of these. And then our home independence visits. I actually just did one for a Yarmouth resident very recently. We'll go into someone's home, we'll look for tripping hazards, we will help them put touch dots on their appliances, we will put down duct tape, fluorescent tape on stairs, doorways. I will bring with me lights, tints, and magnifiers, and if they tell me the things that they're struggling with in their home, then I will pull things out of the office that might be helpful. For instance, if they're telling me they're having difficulty making phone calls, I may bring a large button telephone with me. One lady was having difficulty with her laundry, and she didn't want to put pods into her washing machine. This was actually a Yarmouth resident, and we came up with a system where her daughter would come over once a month and put detergent in a round container and bleach in a square container, pre-portioned, so she just felt the shape of the container, threw in what she needed to throw in, and with her touch dots knew which button to press on her washing machine, and therefore was independently doing her laundry. And then the three very most important things that we do, I'm sort of going to hook together. It's going to be our outreach and activities and our self-help support groups. Outreach, we call every single solitary one of our clients each and every month and tell them about their support group meeting. Here in Yarmouth, there are 3 support groups. Yarmouth is actually the largest population that we serve. There is one at the Yarmouth Senior Center, there is one at Thurwood Place, there is one at Heatherwood. We tried to get one going at Maplewood. It didn't work out so great, but I do go visit Maplewood once in a while. The support groups are a place where people can exchange information and ideas. Occasionally there's a guest speaker. All of our support groups are led by somebody who's blind or visually impaired. And they're open to anybody who is legally blind or visually impaired and their family members. You do not qualify for services from the state of Massachusetts unless you're legally blind. And that means your vision is 2200 or worse in your better eye with correction. And not many people meet that threshold. And so for us, it doesn't matter if you meet the threshold or not. We're there to fill that gap until you are legally blind. But the state of Massachusetts only reimburses us for the legally blind folks. So that is where we find funding for the visually impaired folks from all the different towns on the Cape and some private grants that we receive. So outreach and activities are really, really important to us because vision loss can bring a level of isolation and depression that can be really, really heartbreaking. So we try to get people out and about, not only to their support group meetings, but to different activities, such as we took a trip to the symphony, the Cape Cod Symphony. We have art classes. Coming up next week, we have a partnership with an organization in New Bedford that's going to come do a Wheels in Motion program at our office where a live musician is going to play music while the participants get to hold a whale sculpture that's going to be moving, and the music is going to mimic all the movements of the whale. One of the things that we have been doing is we've been scouring the COA newsletters and the local library newsletters, and we find an event or an activity that our folks might be interested in, and then we arrange for a ride for them to be able to go. And we're hoping with a little bit of more funding from Yarmouth that we may be able to expand that program a little bit more, maybe find a few more Yarmouth activities for the Yarmouth folks. We have enjoyed a wonderful, I believe, 20-plus year partnership with you, and we're hoping to continue that. In calendar year 2023, we served 287 Yarmouth residents, unduplicated Yarmouth residents. We offered them, we provided them a total of 1,803 units of service. The other big thing that we are starting to get into is a little bit of family support. There was a request for a family support group, so we were trying to get that off the ground. And the other area that we're sort of dabbling in, I mentioned that I attended the Good Health and Wellness Fair on Friday, and a lot of people come by and they'll say, oh, sight loss services, I'm not there yet. My vision is perfectly fine. So we are also starting some healthy vision awareness programs. May is Healthy Vision Awareness Month, so at the health fair on Friday, I was giving away sunglasses and eye healthy recipes and that sort of thing. So with that, I mean, I could talk about sight loss services forever. I kind of put it in a nutshell for you, but are there any questions?
Thank you.
Anyone? Tell us something a little bit about transportation for these people.
So for the support group at the COA is very, very generous with their van. So we can call and we can say, this person needs a ride, and usually they're able to accommodate. If they are not able to, if they're short a driver that day or whatnot, so these activities usually happen outside of the town of Yarmouth, which obviously the COA cannot provide the transportation. So we use a company called Habilitation Assistance. They are based in Plymouth, but they have an office here in Yarmouth over by Stop and Shop. You'll probably, on the Stop and Shop on Long Pond Road, you'll probably see all the habilitation vans all lined up in the parking lot. We use them. And then they also have a pretty serious driver shortage, so when they can't accommodate us, we use Prime Medical Transportation a lot. That's also a new program that we have. We've partnered with Elder Services. We received a grant from them to provide medically assisted transportation to folks who are 60 or older that need to get to cataract surgery or things, procedures where they're going to be under anesthesia and they need somebody to be responsible for them, and they don't have family here. So we will arrange a ride to cataract surgery for them with the medical transportation company.
Providing any assistance of what people can do at home on computers?
Well, you can't be released. They won't release you from OCB in Sandwich without somebody being responsible for you and to leave the building. Once you get home, you're fine, but they won't let you out of the building without somebody being responsible for you. So that's where the medical transportation company comes in.
Maybe I didn't follow that. What I was really asking about at home, and the use of a computer. Is there anything that's provided for someone in order they can see a screen?
So most of our clients, I can count on my hands how many clients are under the age of 80 probably. So most of our clients are very technology resistant. But if somebody were to ask for that, we would help them to secure that.
You mentioned newsletter. How do our residents find you?
So we do have a website, www.sightloss.org. We actually did receive a grant recently to upgrade it, so please, if you look at it now, come back again another day. But you can go to the website, pop us an email in the Contact Us page, and let us know you'd like to receive the newsletter. It comes out quarterly.
Great. Okay, thank you.
You're welcome. Thank you for having me.
Okay, the Yarmouth Food Pantry.
Good evening. My name is Susan Martin. I am the Executive Director of the Yarmouth Food Pantry, and I'm accompanied by Kathleen McClellan. And you can see we have support from our board members, some executive and board members seated behind me. Ordinarily, when I come in here, I give you a report hoping that our business diminishes. Last month we've started the pantry in September of 2010. So for 14 years, we've been operating and helping people with food insecurity. Last month was our busiest month ever. We served 736 people from Yarmouth. 24% of those were children, and they came from almost 200 households. Over the last 14 years, we've been averaging in Yarmouth about 20% of children participating at our pantry. And last year, it grew to 24. Now, last month, we saw 26. So what we're seeing is larger families with children that have trouble making ends meet and rely on us to come and help with that problem. And unfortunately, it's getting worse. We bring in 5,000 pounds a week from the Greater Boston Food Bank. We buy food also, and we purchase meat from Dennis Public Market every week for our Meal of the Month program. Some of you may have heard about that because I've been here before. But our Meal of the Month program is similar to Blue Apron. Does everybody know what that is? It's everything you need in a bag with the spices, the recipe, everything that's there to make it. We change that every month so that it helps our clients use food that we supply to make a healthy meal at home. So that's quite the accomplishment, I think. And also it changes. So this month we're doing spaghetti. They get the ground beef, the pasta, the recipe, the spices, diced tomatoes, and everything, and an onion, and the recipe. And we also have it translated into Spanish and Portuguese, just in case we have a language differential. But this I brought. You may thought I brought you a gift. This is our children's snack bag. We give it out to children ages 3 to 11. And the reason we started doing it was because 5 years or so ago, we went over to Swan Pond Village. The kids over there during the summer were getting lunch Monday through Friday. Well, we worried about the weekends. So we started bringing these over on Friday and did it all summer. And one little boy held up this bag and looked at us and said, "What did I do to deserve this gift?" So we just cannot give up the project. The price of the bags have doubled due to inflation, but every child ages 3 to 11 gets a healthy snack bag when they come in. It's our effort to help them choose raisins or a sugar-free fruit cup, a granola bar that doesn't have nuts. And we put milk in there, and we also put in a mac and cheese and enough milk and a little 8-ounce package of milk so that in case the family runs short of food, they can always make that for their child. It's not the healthiest option, but sometimes we'll put a can of tuna in, but we just wonder if that's enough without the bread and everything else. So we put the mac and cheese. But the children walking through the pantry with these little bags all think that we gave them a gift. So that just delights us. It motivates us to make them all the time. We give out a couple hundred a month. So I thought I'd bring this to you. You can kind of see inside. But whenever that little boy asked us what he did to deserve the gift, we just couldn't go to a brown sack and hand these out anymore. So we go the extra mile and make the kids feel special doing that. Kathleen is going to talk to you about our volunteers.
We have approximately 278 people. It moves every month. We get new volunteers, but the entire agency is run by volunteers, from Susan, our executive director, the entire board, and all of our volunteers. We're unpaid. And for the number of people that we serve, I think that's rather commendable, and for the amount of time that the food pantry has been in existence, it's exemplary as well. Our volunteers provide us with the opportunity to do food drives. They assist us with moving food from the donations that come in. Every item that is donated needs to be inspected and need to comply with the expiration codes on all of them. They need to be shelved. They need to be rotated so that we're constantly aware of what's happening. That's what our volunteers are primarily doing, along with the distributions that occurred throughout the week and on weekends as well for families. So they're very important. We also have a cadre of volunteers, mostly men, who go and pick up food from various grocery markets and outlets in which they are donating food to us. So the men are bringing it in. People at the pantry are sorting it and getting them ready for our clients. What else can we say?
Well, there's one program I'd like to mention, if you don't mind. About 4 years ago, an elderly lady came into the pantry. She was a senior, of course, and I walked up to her, and she was well-dressed. You could tell that she was very educated, but she had been coming to the pantry for a couple of years, and I had gotten to know her. And I walked up to her one day and I said, "How are you?" And she said, "Sue, I think I'm considering suicide." And I said, "Don't tell me this. Why?" And she said, "I don't think I can eat peanut butter for the last week of another month until my Social Security check comes in on the 3rd of the month." So, of course, we gave her food. I told her to never do that again, and please come in whenever she needed that additional help. I just said, "Look around you, look at all the food. You don't need to live like that." So it motivated many of us to decide that we want to get the seniors into the pantry. So I worked with the senior citizens, what's it called?
Yarmouth Senior Center.
Yeah, the senior center. And they were abandoning their brown bag program that they gave out on the first Friday of every month. So with them publishing our services in their newsletter and offering to bring housebound seniors over to our pantry, we now have 2 senior food distributions for just seniors. And so far, we have about 40 coming twice a month. And when we heard that from that lady, we moved to give out food twice a month. We were giving out a full food distribution and then allowing all of our clients to come back and just get meat, because protein was the most expensive thing that they were lacking, and we figured that would be a help. But when this lady told us that, the board and I agreed that we should do it twice a month. So now all of our clients can come in and get everything twice a month. But our biggest joy is that senior food distribution that we have. The clients come in early. It's almost like a social hour. They're not in a hurry. They enjoy coming, and they go home with a full grocery cart of food. So if there's any seniors out there that need help, I encourage them to come and see us. They'll be delighted if they do. I mean, can I answer any questions?
You want to tell the public the location of the pantry?
Yes, we're at 845 Route 28 in South Yarmouth in Lighthouse Landing. And you can also find us at yarmouthfoodpantry.org. And our phone number is 508-398-0880.
We're on Facebook.
Oh, we're on Facebook.
I have a question for Susan.
Sure.
Susan, we didn't get the sheet that showed where your funding comes from. Can you give us just a quick overview?
We have an annual golf tournament that we do on the first Sunday of every November. It's called a turkey shoot. The Yarmouth Police Department does 2 big food drives for us every year at all the major grocery stores and Peterson's. And they raise quite a bit of money for us, along with probably $7,000 worth of food every time they do it.
Stuffer Cruiser.
Yeah, it's called the Stuffer Cruiser. The Dennis and Yarmouth fire departments do their Homeless for the Holidays that benefit our organization. They raised quite a bit of cash for us, and they also bring in probably each different fireman group brings in probably about $7,000 worth of food. We write grants. We have some very generous donors in our town. And also, we do serve all of the Cape, all of Barnstable County. And we have 12,000 clients on our books. So I'm sad to report that we're not close to going out of business, which really has been our goal. We would like nothing more than to go out of business, but we're busier than ever. I'm sad to report.
We're glad you're there. Thank you.
Thank you.
Questions, any comments, anyone?
Just quick.
Yeah,
So it's an impressive organization, what you're doing down there. I've had a chance to see it. food is medicine, right? You're doing public health work at a community level, so thank you for what you're doing. But I do want to recognize probably your most recent and maybe youngest board member is here.
She is.
Yeah. So Nora, and you'll recognize the name Nora Brunage, Nora, come on up. You'll recognize the name as your former colleague, Deb Brunage. Charlie, you would know. Larry, this is before your time. But I have every reason to think that not only will she on the executive board, someday she will sit on your board. I'm confident of that. So you're following tremendous footsteps of your mom, Deb Brunage. And I want to just talk a little bit. You did some work this weekend out.
Yesterday.
You want to talk in the microphone? You're in Hyannis.
Just yesterday, we went to Hyannis and participated in Hyannis Open Streets, which was a wonderful event, and we were able to get the word out to many people who needed our services, who were located in Barnstable and Hyannis area. So it was a really nice event that we did. And yeah, I worked on it for a few months, and I was really proud of the outcome.
Nora is our junior board member.
Congratulations, Nora. Wonderful. Very impressive. Very impressive.
Hi, Mom.
That's wonderful. Thanks.
She's a non-voting member, but it's great for us because we're older. She knows social media.
Sure.
And she knows Twitter and all these things that we're not really up to speed on. So she's been a huge help.
Yeah, but the passion, right? And the next generation the coming up, wonderful. Continue the great work.
And she's
Wonderful.
gotten a lot of young people involved at the pantry that come and volunteer now.
Invaluable. Nora, congratulations.
Great. Okay, thanks for coming in.
Thanks for having us. Thank you for your
Thank you.
support.
Yep. Thank you.
Next year, I'll bring you all one.
Okay.
One more. One more.
Just a
Keep late.
just one that you had put down here.
Yeah, it should be the last one. I don't know if anyone's here from that Cape Cod Bright Lights.
Great. Sorry about that. Good.
How are you? Good to see you.
Thanks.
Just the right amount. Thank you.
Good evening, thank you. My name is Steve Albright, and I am the president of Cape Cod Bright Lights. We were founded by 10 members of the Yarmouth Rotary Club about 4 years ago. We incorporated as a 501c3 nonprofit. We're 100% funded by private donations and grants. We also are a 100% total volunteer organization. And when we started the organization, we wanted to involve the community in what we were doing. So every board director and some of their family members are involved. We have a troop of Boy Scouts and Girl Scouts involved, the DY Regional High School Interact Club, Red Jacket Resort employees, Yarmouth Rotarians, and recently we brought on some employees from the Barnstable County Probation Department. We have a very, very simple mission statement to help those in need on Cape Cod and the islands. We started out similar to another nonprofit here on the Cape Cod Kids Meals, but we wanted to do more than just the backpack programs, but that has been one of our biggest programs that we've done. So what we do is we pack weekend backpacks, and actually they're plastic bags that they put into their backpacks of nutritional food for the weekends for grade K through 3. Right now we're packing 60 to 65 bags per week. Each bag is 15 to 16 items. They get a minimum of 2 breakfasts, 2 lunches, snacks, milk, juice, and 2 pieces of fresh fruit, the fresh fruit being donated by Stop and Shop every week. Some of the food items that we put in the bag are large enough so they can share with others. We also provide boxes or cases of snacks for Emmy Small and Station Avenue every month for kids who don't bring snacks in. That way the student doesn't have to sit there and not have a snack while the other kids have snack time. We started a new project last year, hygiene products. We learned that in the high school and the middle school, girls were going to school and they didn't have any feminine napkin pads, so we started providing feminine napkin pads. And then we, in addition to that, we learned that some of the kids didn't have the items to take showers, and so they were going to school smelly and offensive to other students, but it really didn't improve their self-image. So we started providing large bottles of shampoo, soap, body lotion, deodorant, toothpaste, toothbrushes to the school nurses. So everything we do through in our project, we do through the social workers, the guidance department, and the school nurses. So we provide them both to DY Middle School, DY High School, and also to Cape Cod Tech, since we have a number of Yarmouth residents in Cape Cod Tech. Like I said, we do work directly with the social workers, the guidance department, school nurses. Some of the other projects we provided to the school are reusable water bottles. Students would leave their bottles at home or they'd lose them, so we provide cases of water bottles to the elementary schools for the students to replace their missing bottles. The high school had a need for backpacks. They identified 12 or 15 students that didn't have backpacks, so we provided really high-quality backpacks to the students at the high school. Looking to our future, we continue at the minimum of what we are currently doing, providing those weekend backpacks, providing the snacks to the schools, providing the hygiene products. We'd like to expand our outreach into the schools, and we're also looking to expand our outreach to include senior population in the town, and work with the senior center to see what else those people need. The other thing we do is we provide gift cards, so I'll get a call from or an email from a social worker in one of the elementary schools that there's a family in need. Recently we had one where the mother was a part-time bus driver at the school. The husband lost his job. He was waiting for unemployment to come in. They had no food in the house, so they needed some items, so we did provide them with $150 worth of gift cards. Also gave them the information to the Yarmouth Food Pantry so they could go there if they needed more help. The one thing about our project is we are not income driven. So we, as they said, we allow the social workers and that to decide who needs it. So we're a need-based group. We're also, we're very fortunate that the Yarmouth Food Pantry allows us to use their space to pack our bags. So we don't have any rent or any electric or anything like that to cover. So all of our money that we raise basically goes towards the products that we provide to the people and the services that we provide. We call ourselves a just-in-time. We're at the old Japanese manufacturing way that they used to do it. So we utilize the food pantry. We buy the food that day. We pack the bags, and it goes out the door the next morning. So that's basically what we do at the at Cape Cod Bright Lights. Like I said, it's a new organization. We're growing every day. We started out with 15 bags. We're up to 65. And when I multiply by 15 to 16 items, we're going through 1,000 items a week, so it's a lot. You mentioned to the Cape Cod Cooperative, or the food place down at the old Riverway, about Boston. We've reached out to the Boston Food Bank probably 5 or 6 times. We've been denied every time because they're not taking on new organizations. So they say, we'll put you on a waiting list, but we don't wait for the waiting list. We keep on reapplying, and they have a number of items that we could use which would help cut our costs down. And some of the families, I just tell you, that we've dealt with, I belong to Yarmouth Rotary. We have a Christmas party, holiday Christmas party, and the social workers give us all the names of the families who are really in need. So we also provide transportation to that Christmas party for families that don't have transportation. And I was always one that was always skittish about driving through Swan Pond, but I had to go pick up 3 families in Swan Pond and bring them back home. And the stories that you hear is just unbelievable. I had one family, there was 6 people in the family. The oldest one in the family was 19. It was a 19-year-old boy. There was an 18-year-old girl. There was a 15-year-old boy, 13, 11, and 9. And There was two fathers involved. Neither one are around. The mother was in a hospital in Boston getting ready to be transferred long-term to Florida. The 18-year-old got custody of all the rest of the children. So we reach out, we help them every once in a while with gift cards to get them going. Another story that we hear that we help is there was a mother there with 3 girls, no father involved. The grandfather used to come and help her, but he perished in a house fire recently. So, and the 7-year-old is autistic, so she's still in diapers, and the cost of the diapers and the wipes to clean her up and all that is expensive, and she just doesn't have to. She works at Stop and Shop, so we provide her with gift cards too to help her along the way. So we're there to help people. We don't go looking for them. They come to us based on, like I said, the social workers and the guidance department and the nurses in the school. So we could always use help. That's why we're here tonight, and we appreciate anything you do for us. Any question?
Yeah, unfortunately impressive.
Thank you.
Thanks, Steve.
Yep.
Thank you.
Thanks.
Thank you.
12 very impressive organizations that you've
Yeah.
heard from tonight.
So, we have a lot to think about here in how to distribute $60,000. I see it's kind of complicated, so we need to certainly give it a lot of thought. Very different organizations, and
Miller?
yes.
I'm sorry, I interrupted you. Go ahead. I just have a question when you're done.
Maybe I'll talk for 35 minutes. What's your question?
I think it's also complicated by the fact that we really are obligated to fund the VNA at least a certain amount because they are performing required services by the health department. Correct?
That's true, Mary.
Yeah.
But they do our communicable disease tracking. That's true.
So,
Right.
yeah, good point. So that'll be helpful to know some numbers from you, Jay. But certainly, I think we should have a discussion at our next meeting, at least start this. The organizations, obviously, it's different services. The scale of the business varies tremendously. As you could see, the last one was sort of a startup, was new. The approach of what people put on their applications for requested amounts, their approach are very different of what they put down. Certainly you need to consider specifically how do our residents in Yarmouth benefit. So we have a lot more applicants also. I mean, that's good in some ways for sure. And so review the notes you made today and all the information received, and what we're going to need to do is come up with some kind of method the 5 of us work on to really distribute certain amounts of money to certain organizations. I mean, there are no rules to it. It could go to one organization, it could divide it up among all of them. And that's really, that's up to the board of how to do this. What does everyone else think? How we should move forward here?
My thought, I mean, just without really looking at all these again, would be to try to distribute the funds as best we can to all the people that applied. Possibly we could give exactly what some people are asking for, and others we won't be able to. But try to include everyone.
Okay.
That's sort of how I would approach it. I mean, but I guess maybe personally I had some more preferences than others. Certainly food scarcity was a priority in my mind, so I felt like maybe I'd rather support, or I would be more apt to support those organizations as best we can, and then start to filter out the others as we look over all the requests.
Yeah, we have to come up with what our personal feelings are priority-wise. What do you think, Charlie?
Right. Yeah.
First of all, how much do we have to play with?
$60,000.
60,000?
60.
Okay, is that something, do we have to make a decision tonight?
No, not at all. I think we have a lot of work to do to figure this
I go
out.
home and I go through what I think I'd rather spend it on and come up with $60,000 and then come back with a recommendation.
Absolutely.
Yes, I've always, I got together with the Yarmouth Police Department every Christmas for the food pantry, and I've raised a lot of hell out there. Actually done some serious shopping for them, but I'm damn proud of that. They wanted to put me on the strangled times one time, and I told them no way. I said, but you know, I've spent some serious money on the food pantry, and I think they deserve every minute I've had with them. But then, like he says, I have some preferences, and then I probably have some prejudices too. So I mean, you know, it's something I'd like to sit down with myself and go through this.
Yeah.
With the next meeting, would be possible to make a decision, possible for me to make a decision.
Okay.
This spreadsheet would be a good working document to do that deliberation. You have what they've requested, so you can kind of work with that, but knowing that, you know, some might be upwardly or downwardly adjusted, coming to a total of 60, if it's going to be all 12, but this spreadsheet should be a good working document for you to start.
Okay, yeah.
And I would like to thank you, Hillard and Jay, for making sure that these were just 10-minute presentations and that people stuck to them, because that was very helpful this year.
Yeah.
Mary, you still in the car?
Yes,
Okay.
but I'm at home in the park and in my driveway. My neighbor just tapped on the window to see if I was okay.
Right, hopefully the car wasn't running the whole time, so.
No.
Right, parking in your own driveway is usually a good bet. Okay, so.
Yeah,
we're on-
watching the sunset.
There you go. We were not doing that here, in the basement. Okay, so next here on the agenda is number 4, and that's the discussion on service animals in local restaurants. And it says here definition/clarification. So.
Eric has this?
Yes, Mr. Chairman, thank you. So I don't know if anybody's recognized or noticed recently there's been, people are taking animals into restaurants and grocery stores and stuff that are not service animals. It's a very sensitive subject for the employees to regulate, and staff members how to regulate what to say to them and stuff like this. I found this from the Barnstable Health Department. I kind of reworded it for the Yarmouth. I'm just going to go ahead and read this real quick. The Town of Yarmouth Health Division enforces a state sanitary code and the 2013 Federal Food Code. Only service dogs that are trained to assist people with disabilities are permitted at licensed food establishments, which includes outdoor patios. Please note, emotional support animals and pets do not qualify as service dogs. This is not a new regulation. Only when the individual's disability is not obvious, a staff may ask the following 2 questions to determine whether an animal is a service animal or not. The first question you can ask is the animal a service animal required because of a disability? The second question is, what task or service is the animal trained to perform? The law requires the staff to take the individual at their word. Service dogs are not required to wear a vest. So you have a lot of people that bring their dogs or cats, or there's even ducks, saying they're my emotional,
Not cats.
Yeah.
They say they're their emotional support. Yes, it probably does create emotional support for them, but under the ADA laws, only dogs or small ponies are service animals. So Barnstable has every food establishment have one of these posted on all their restaurants and grocery stores. I don't know if we'd want to do that, but I'd like to at least distribute these to all the food and restaurants to the town. Phil and I can get them out. I think it's good to have it posted where people come in and see, because now that the season's coming up next week, I've always gotten a lot of calls from restaurant owners and the establishments saying, well, what can I do in this situation? What is my responsibility? And unfortunately, it doesn't land on the customer. It lands on the establishment itself for breaking the code for allowing non-service animals in the establishment.
Should this be a regulation from the health board?
It already is. It's a state regulation.
All right. So what is this that we have in front of us?
It's just a letter that I composed, and I'd like to get out to all the restaurants and food establishments, grocery stores, stuff like that. Go ahead.
Summary? It's just a summary of the regulation?
Yes, ma'am. It's just so they have something to go back on. They have a customer that comes in and they don't know, the 17-year-old hostess doesn't know what to do. She has this as a reference of what they can say and do, and what actually is allowed and what isn't allowed. It is a very sensitive subject to ask somebody, but if they have resources to get it out, they might not all know the state regulation on this.
And these follow the wording of the state and federal food code?
Yes. Right. It's a clarification, Mary.
What you have given us titled service dogs, the wording is exactly in sync with what is in the state sanitary code and the 2013 federal food code?
Yep. And those are the two questions you're allowed to ask.
Okay.
Is this a letter, or is this something you were thinking that needs to be posted?
Barnstable has them posted on the front door. I don't know if we need to make every establishment post it. I would like to see that personally, but at least they have it accessible, and if there's a question, that they can have it as a reference if somebody brings an animal in. Right. So at least if it's posted on the front door, guests coming in can see it and say, oh, well, maybe my emotional support dog is not a service animal, I can't go in there.
So perhaps a cover letter could be sent with this? Or are you going to distribute it, a cover letter just saying this is being supplied to you because there have arisen a number of questions?
I'd be more than happy to do that. Yes, ma'am.
Yeah, and then you could say you may post this if you would like, but it is specifically for the information of your staff who might have to confront such a situation.
Yes, ma'am.
Yeah, I think it would be helpful to have both of them. If there are issues that other customers and stores can come in front of us, that it would be helpful for the health department, well, the Board of Health also, that a letter was sent, here's the date, and we provided you with this documentation.
Yeah, and just put the date down at the bottom of this service dog information sheet too.
Okay.
Please. Yep.
Now, this mentions outdoor patios.
So example, the Sea Dogs right now, they have that new outdoor patio.
No, I know.
But you can't have animals out there either.
What happens at farmers markets? They need a license for food. It's outdoors. How's that different? Or what happens with that?
I would say it's still underneath of a food service, a retail, not allowed. Like you can't have them in grocery stores. So I would assume I'd have to look into that a little bit more. I can contact my contacts at the state level on that. But
that can be difficult. People getting out of the car with their dog.
Yeah.
For the day, they're stopping off a few places. Farmers market. Yeah, see what some other.
I think it depends on how they define a food establishment.
Right.
Yeah, for sure.
That's retail. That's not food service there. It's retail food there.
But so is it in supermarkets that don't have salad bars and things like that.
No. Yep.
And they're not allowed in there. So yeah.
I'm a big dog fan. If I could take my dog everywhere with me, I would love to, but I have to.
So
Yeah.
Barry, what's the basis for this law? I mean, what basis do they have to not allow dogs in these facilities?
Sanitary.
Because there really aren't any different health issues.
Sanitary code, I guess. It's
Sanitary
state-
code. What's unsanitary about dogs that aren't, that makes people so sanitary?
Well, dogs do not use toilets. For
Yeah,
one.
that's a good point.
Dogs bark,
That dogs bark, that's not a health issue. The dogs would be disruptive, or they could interact with each other negatively and upset a facility that way. They could defecate that the owner would have to be responsible for, but I think it's a myth if you're going to say that the dogs are harboring some disease that are going to be an issue in a restaurant, because that's not the case.
It's the state sanitary code, so yeah.
Fine, but, you know, it might be just an old law that maybe we need to look at. Not saying the Board of Health in Yarmouth has to do it, but I think it's a sort of an arbitrary rule that has other implications besides health issues. Because, you know, when you think about it, your dog in your house, everywhere you are, and somehow we remain pretty healthy.
Well, dogs in stores, though, are not, those are different circumstances for the dogs. We don't know how well the dogs are controlled. And food is food for a dog. So I can see a dog just grabbing something off of a shelf or, you know, from a cart.
Yeah, I totally agree with you, Mary, in that respect. The point I was making is that there aren't really any health issues. There are behavioral issues with regard to dogs being in these places, but it's not health-related.
Okay.
Right. I mean, we could outlaw toddlers, too, for that point. But they wear diapers, so.
I do
No,
know
I just-
one dog that's allowed
We can write
anywhere,
something
Sort of scratch my head on it.
anywhere, anytime.
Yeah, a legal service dog, yes.
One's from the state police that are retired. Boy, you talk about well-trained.
Yeah, they're
They're talking to me about taking one.
okay.
Yeah, unfortunately, everybody doesn't have a well-trained dog. That's the problem. As Mary pointed out, you know, defecating in a store or restaurant would be offensive,
The
obviously.
thing about the state police dog is that once you assume responsibility for the dog, in other words, I take one of their dogs, that dog goes with me everywhere I go.
Yeah, and it's a service. It's a registered service dog, so yes, it's allowed to.
Go anywhere without it.
That's what it's allowed. So.
And when they said that to me about that, they wanted to know if I'd rescue a horse. Wait a minute.
And I don't know why it's dogs and small ponies are the only two that are acknowledged by the ADA, but
That's above our purview.
yeah.
So,
And fortunately, you didn't include small ponies in this letter or notice. Oh, God.
Okay.
okay. You're okay with it?
Yeah.
Discussion-wise?
Yeah.
All right.
I'll do a cover letter and put a date on it and
Okay.
get it distributed out to the local establishments.
Okay. Yes.
I apologize, I just want a little clarification. Did we just make a motion that this needs to be issued to everybody once he makes a letter? Is that what you just did?
We
Don't
didn't,
distribute it now.
we didn't. I mean, we didn't vote on it. There wasn't a formal motion. The board members, do you think there needs to be?
No, I think it's just a recommendation. We're agreeing with his doing it. That's how I look at it.
Yeah, I assume that's what we're doing. You're okay with that, Charlie?
Okay with it.
Okay,
Spread
fine.
your knowledge. Thank you.
Thanks for asking. Okay. Okay, we have a final migrant update here.
Sure. So you can see the word final. The migrant program was extended to Yarmouth back in September 11th of last year for 7 months. Migrants have been there. Each meeting, you've received an update and that has progressed. We work cohesively with the community, we worked with the state, and as of April, several weeks ago, April 23rd through the 25th, April 25th being the last day that all the migrants were moved out to other locations. We weren't really given specifically where they went, but the Harborside Suites is now back to taking reservations by the public. So that program has ended as of April 25th.
Okay.
That's it. Final update. You won't see it again.
Number 6 here is the COVID update. Barry, is that you?
Yes, sir. Thank you, Mr. Chairman. COVID update for last month, 4/14 through 5/11. Yarmouth was down. It's 1.59% positivity with 4 positive cases. The county was at 3.82, and the state was at 3.48%, so we were much lower. Last 2 weeks, 4/28 through 5/11. Yarmouth, 1.52 positivity rate with only 2 positive cases of COVID. The county was 4.47%, and the state was at 3.86%, which was down from our previous. And then last week, there were 5/5 through 5/11. Yarmouth had 1.56 positivity rate with only 1 positive COVID case being reported. The county is at 3.91, and the state was at 4.10. So numbers are going down, which is good. So,
would the board want to keep this as a continual update? But the numbers are down to single digits.
Right. It's just my opinion right now. I don't think we need to be doing it. Part of the reason the statistics now are, I don't think, is helpful with all this self-home testing. So I'm okay if we discontinue for the time being, and if COVID starts, spiking again, or we have a new pandemic that's starting, if we did, sure. I don't know. How do other board members feel about it?
I agree.
I agree too.
I agree, 3.
Okay. Yeah, I don't think we were taking advantage, or, I don't think it's helpful right now. So it's great. Okay, thanks for the point, Jay. Great.
Thank you.
Any new or old business?
I would just say the new business is that your colleague, Eric, is on his honeymoon right now.
Oh, great.
Oh,
Wonderful.
Okay?
I didn't know that was public. I didn't say anything. Okay, so
well,
it
he
was.
sent it to me. Yes.
He did. Okay, I kept my mouth shut. Okay, yeah.
Okay. We wish him well. We wish him well. I happened to bump into him when he was upstairs getting his marriage license, so.
congratulations.
Yeah, wonderful. So we'll congratulate him in person when he gets back.
I suppose that's an excuse for not coming tonight.
Well, I did question him on that. I said, gee, couldn't you fit this in? But no.
It's only 2 hours. Come on, Eric, it's 2 hours. Come on.
Yeah, there you go.
Okay. Anything else?
Nope.
I think just for me being new to Yarmouth, I just want to say this: the grant thing was very eye-opening for me tonight. I just wish we had money to give everybody what they wanted and more. It's amazing what they're doing for our community here in Yarmouth and how much support.
Yep.
I mean, people say that, like, even with the migrants, how people aren't helping. Yarmouth is a very giving community to people in need. I'm finding out it's great. So thank you to the community on that one.
Yeah,
I agree.
It's gonna be a tough meeting. I mean, yes, not to give people money and with what they're doing. I agree with you, Barry. So we just need one more motion, or our first motion for the evening.
Actually, January, we have June 3rd for the next meeting. Do you want to set that for everybody? The first Monday in June?
I assumed it was.
You want to go to a summer schedule? I'm not sure how you're going to, is it June, July, and August, or just July and August?
We may do that. We can talk about it in the next meeting. So it'll be the 3rd, June. Next meeting, that's good. That's the end of new business. Okay. Anyone?
Make a motion to get out of Dodge.
Okay. Second. Okay. All in favor, raise your hand, say aye.
Aye.
This meeting's adjourned. Okay. Thank you, everyone.
Hey, everybody.
Thank you.